How to distinguish between psychiatric patients and normal individuals in psychiatric hospitals, Rosenhan experiment. Stanford University psychologist Rosenhan has always been very interested in the topic of whether people can distinguish between mental illness and normal people, because he found that many people at that time used mental illness as an excuse to avoid military service. In 1972, he invited his 8 friends to pretend to have symptoms such as auditory hallucinations and play the role of mental patients, and asked them to no longer pretend to have symptoms of mental illness after entering the hospital, but to live in a normal state and apply for discharge. The results showed that these pretended mental patients were not immediately diagnosed and discharged by doctors after returning to normal behavior. Instead, they stayed in psychiatric hospitals for an average of 20 days and were also labeled as recovering from mental illness after discharge, without recognizing them as normal individuals. It is worth mentioning that when fake patients were living a normal life in a mental hospital, some real mental patients even discovered that they were pretending and believed that they were undercover reporters, but the treatment doctors did not notice. Rosenhan quickly released the results of this experiment to the public, strongly questioning the ability of psychiatric institutions to judge mental patients, causing a stir in society and strong opposition from psychiatric institutions. So Rosenhan announced to various psychiatric institutions that he would send some fake patients to medical institutions for treatment within 3 months. Each psychiatric medical institution has used all means possible, claiming to have found 41 undercover agents out of 193 patients within 3 months. Soon Rosenhan also revealed the answer, stating that he had not sent a fake patient to a mental hospital in the past 3 months. Medical institutions are completely defeated. At that time, the Rosenhan experiment proved 2 points. Firstly, psychiatric treatment institutions were unable to truly distinguish between a mentally ill person or a normal person, because their discrimination criteria only relied on the patient's family's oral statement. After discovering abnormal behavior, they were judged as mentally ill without testing standards as a reference. Secondly, once a doctor labels a mental patient as mentally ill, this stereotype is deeply ingrained in the doctor's perspective, and no matter how normal the mental patient's behavior may be, it will be considered a symptom of mental illness. The Rosenhan experiment gave a resounding slap to psychiatry at the time, which also led to a major revision of the Diagnostic Manual for Mental Disorders, which can be said to have profound significance. In the next issue, we will enter the Hawthorne experiment to examine the impact of subjective motivation on people's behavior.